Hi, I'm Dr. Michael Turner. I've been a chiropractor in the Tampa Bay area now for about 15 years. And over the past few years, I've noticed an alarming trend, and that's the increase of people coming in looking for headache and migraine suffering relief. People have been trying all sorts of medications, whether it be over-counter like Excedrin, migraine. They've gone to specialists. They're taking Imitrex or other medications or drugs that are not improving their state of health. And I've even had people go as far as to having Botox shots in the neck to try to reduce these headaches. And listen, I get it. They're debilitating. They take away your life. You have to go lie down. You're having trouble taking care of your children, trouble concentrating at work. And I understand the purpose of taking these medications. But so far, none of those things have helped, and they're seeking help elsewhere. Now, a lot of times people don't understand where the headaches are actually coming from. And a lot of times what we're seeing is that people have these headaches due to the structure of the spine. Now, if you look at the proper structure and alignment of the spine, your head is over your shoulders. You have a nice 45-degree curve there. And when it's like that, there's no pressure on the nervous system. There's nothing causing interference between the way the body is functioning with the rest of your body, or with the brain is functioning with the rest of your body. And so, but when you have misalignments in the spine, whether it be from a car accident, whether it be from sitting in front of computers all day, whether it be from texting all day, looking down at other devices, you change that alignment of the spine. What we're seeing is people with a lot of forward head posture, where the head looks forward like this, and that's causing a lot of crushing pressure right there at the base of the spine. We're seeing that banana, that curve, that 45-degree curve, has been lost. And when that happens, you're putting a lot of pressure here, and especially putting a lot of pressure right there at the atlas, the top bone in the neck, and where the brainstem meets the spinal cord. And we're finding a lot of headaches are coming from that. I'm going to show you an example of what I mean. This is John. John came in about a year ago. John's 34 years old, 2 kids, gainfully employed, but he was having a great deal of problems. He was taking, like I said, he had taken the Imitrex. It wasn't helping. He was taking the over-counter medications. Wasn't helping. It was causing strain in his marriage and causing a lot of problems with his career. And he came to us looking for help. When we took x-rays of John, what we noticed is that not only had he lost that 45-degree angle, it was about a 19-degree angle. He had that forward head posture. Anything over 20 millimeters is what we consider anterior head carriage, and that puts a lot of strain on that spine right there. And then right here, that atlas, that first cervical vertebra, is almost touching his occiput, so putting a lot of crushing pressure right there, like I said, where the brain stem meets the spinal cord, and causing issues going down to the neck, and then headaches going up into the head and to behind his eye. We saw John for about 3 months to work on corrective care in his neck, and afterwards, this is what we saw. His 30-millimeter forward head posture went down to a 10. His curve went from a 19 to a 34, and look at the open space right here between his occiput and his atlas. John no longer has headaches. He's not taking the Imitrex. He's not taking the over-the-counter medications, and he says his home life is better. John is much happier here than he was 3 months ago, and because he found a solution to the problem, not just covering up the problem with the symptoms with medications. I want to show you another example. This is Jenny. Now, Jenny came to us with a very similar problem. She'd even gone as far as to taking those Botox injections in the back of her neck to try to alleviate these headaches, to no avail. What she had going on was a little bit different. She actually had a reversal of her cervical curve. She had been in multiple car accidents, and so her curve was actually a negative 13-degree curve. She had an anterior head carriage of 44 millimeters. That's close to 2 inches of forward head posture. Now, when 3 months later, when we took her x-rays, she didn't have that beautiful curve, but you know what she had? She had a positive 5 from a negative 13. That's an 18-degree swing, and her forward head, her anterior head carriage went from 44 millimeters to about 17. Again, this is a much happier mother of 2 children than she was back then. If you or someone you love or know is suffering from these terrible migraines or other types of headaches, let them know, or come find out what our solution is. The only way to find out if it's coming from the cervical spine is to take an x-ray. And if this makes sense to you, I invite you to call the number below and give us a call. Reach out to us and see if there's something that we can do to help you. It'll be a no-charge consultation. That way we can find out if there is something we can do to improve your life and your health. Thank you and have a great day.